Hi, my name is Dr. Dometrives Armstrong. I work for Interim HealthCare San Diego Hospice. I am one of the nurse practitioners. I go out and visit patients, but due to COVID, I have been doing telehealth visits with our amazing patients and family. I just want to share that I started off as a nursing assistant. I graduated from San Diego City College with my associate degree. Then I attended University of Phoenix and attained my bachelor's degree in nursing with public health. Then I took a journey to go back to school at University of San Diego and attained my master's in nursing with a specialty as a nurse practitioner. Then I didn't give up because my journey took me to a higher education of learning. So I attended Walden University and attained my doctorate in nursing practice. I bring joy when I enter into their home. And so what I would like for them to receive from me is to be empowered, to be able to share how they're feeling, and to know that I care for them deeply, just like if they was my own family. Our team is amazing and fabulous because we communicate with each other in a professional manner. We also are there if we are having our own personal challenge, like when my dad passed away. The team was amazing. They supported me during my time of grievance of my dad. Our leadership is the backbone that guides us, support us, and lift us up to ensure that we are not just a team, but a family. So I just want to share a little story. When I was in high school, I wanted to be an accountant. And then, let me start back. When I was 10 years old, I was in the hospital when my uncle was dying. And then I had a nurse tell me, "You too young, you're not at the age range to visit." So I couldn't even say goodbye to my uncle. And then so, as a kid, you're like, I'm gonna be a nurse. But then when I got in high school, I said, I wanna dress up in a business suit. I wanna be an accountant, a CBA, play with the numbers. And then that changed. I had all these dreams. And then when my great uncle took sick and my auntie, my great aunt, needed help, I helped her take care of her husband. So I felt that was my calling, and my heart is so open and big. I'm so compassionate that me and my auntie went to CNA school, and she was about in her late 70s, and we graduated to better care for my uncle. So when he passed away, I said, I think I want to be a nurse, because a nurse is passionate, she's trustworthy, or he, and they have this caring charisma about themselves. And they treat, well, as for me, I treat my patients as if they are my family, because they are my family. And I just love being a nurse. I love what the mission of a nurse is, the value of the nurse is, and that's why I wanted to go back to school to become a nurse practitioner, because I felt that I had more to offer to help my patients. My future goals that I have for myself is to attain my advanced hospice certification, because that's lifelong learning, to become a content expert in hospice so that I can teach and educate best practices to our amazing registered nurses and our amazing hospice aide. That's my goal. That's my long-term goal. It could be a short-term goal too, because I'm very enthusiastic about doing this. I have to say, when I think about my personal goals, I had to really think about this one because I put my work first. And I'm learning now that I need to put me first. So my personal goal, because I love what I do, I give my job 120%, but I probably give myself 50%. So I want to reverse that. I'm still going to be 120% with my job, but I want to give myself and my family 100%. So I want to be mindful about my self-care because I'm starting to realize if I'm burnt out, I won't be effective to do my job. So I need to take care of myself. You know, growing up, I learned about Malcolm X. I learned about Harriet Tubman. I learned about Rosa Parks and Martin Luther King, just to name a few. But based on Black history, I have to say my father is my hero, because if it wasn't for him providing me with the blueprint to encourage me, to motivate me, to give me those words of wisdom, I don't think I would be the person I am today. And I have to also thank my mom because she was a part of that legacy as well. But the main people that I need to get a shout out to is my great grandmother, who was born in 1884, who also provided me with a blueprint. And I have to say that I was blessed to have these women of color in my life, from my great grandmother to my great aunt to my aunties, who empower me to say you could do anything only if you put your mind to it. And my mom instilled that in me as well. Don't let nobody say you cannot be who you want to be, because you could be the person who you need to be. And you do it because you want to do it, not because somebody telling you that you can or cannot do it. You do it because you can do it. I also would like to mention Miss Mary Alyssa Mahoney, who was the first African American nurse. She was a pioneer. So when I learned about her and her history, I said, wow, she paved the way for me to be a nurse. So I thank her for paving that way for me to be an African American nurse, which I am proud to be. My dream goal, and it's big, to go out into our community to talk to students who look like me. Because if I could do it, you can do it. And we need more nurses of color. It's important that we take care of our families. And I feel that when people of color go into a healthcare facility and they don't have healthcare professionals who look like them, there could be a mistrust. And I feel that if we have more healthcare providers who look like me, I feel that our community, our African American community, or our community of color will feel that trust and passion. And I think that with that trust and passion, especially when you have someone who look like you, who's going to care for you, it's going to build a unity within the healthcare system amongst the healthcare providers as well as the patient that we serve. My number one goal in healthcare is to continue with providing safe quality care to our amazing patients and their family. My second goal is to continue with education based on best practice within our company as well as in the community.